name is Faust once more. Hello, everybody. I can't see you, but I believe that you were there. I'm a single-payer activist with the Democratic Socialists of America, and I've been traveling around the U.S. talking about single-payer and, more importantly, kind of what lays beyond that, right? Not just Medicaid expansion or just Medicare for all, but kind of a broader idea of health justice across the U.S. So I've been kind of driving around in my car. I did a tour of the East Coast, the Midwest, and the South. I'll make it up to the Northwest, I think, later this year, talking about what healthcare looks like across the U.S. That's important, right? Because what healthcare looks like in Brooklyn, or where I live, or Chicago, or Little Rock, Arkansas, or Seattle, or Memphis, or Louisville are all very different from each other, right? And kind of the ways that healthcare inequity and healthcare inequality manifests really differ from place to place. And so therefore, understanding, I think, as an activist, what healthcare looks like and what healthcare inequality looks like more specifically is important. So I understand, I think, more thoroughly what it is that we're trying to fight for from coast to coast, from plains to gulf. So I'll talk a little bit about kind of what we're fighting for now, kind of the way I'm structuring that. And then I'm looking forward to hearing the other speakers. I'm looking forward to Q&A. I'm happy to answer any questions you have. Hopefully you can share with me some of the things that you're seeing and feeling and afraid of and fighting for local to y'all in Moscow, so I can kind of understand. Also, by way of disclosure, I currently am employed, even though I'm a single-payer activist, I currently am employed in the insurance industry. I work as a data scientist, which is why I believe the insurance industry must be nationalized, that it is fundamentally an unethical industry which preys upon people. So consider this, please, my active contrition for participating in capitalism. So with that, let's get off. I'm going to read off a thing behind me, so let's see if I can make sure my kind of eye contact lines right. If it looks a little weird, please bear with me. I want to talk about what we have for healthcare in America, what we want instead, what comes next, and what we can do. I want to talk about the overwhelming and numbing brutality of for-profit healthcare. I want to talk about the relatively benign structural changes that we demand instead, and then I want to talk about something bigger, which is a broader vision of a better world, a moral urge of health justice. Y'all with me?
Yeah.
Someone raise your hand saying yes.
Yes.
Fantastic, great. I want to start off by confirming something you probably feel in your bones, which is, deep down, you're being screwed over, right? And the method by which you're being screwed over, the severity or complexity or artfulness of the cover-up varies from person to person, but fundamentally, we have created a world in which you are made sick and then punished for being sick so that someone else can make a huge profit. Let's talk about that. By and large, in the U.S., the costs of receiving healthcare are much more than any individual person can afford by themselves. But not a lot of folks need healthcare in a given year. In the U.S., in a given year, 50% of all medical costs come from 5% of the population. 80% of all medical costs come from 20% of the population. And those costs are fungible, right? They move around. Maybe some years you get hit by a car, or you give birth, or you have a heart attack or a cancer scare, and other years you don't. So costs move around from person to person, but if everybody had to pay all of their own costs out of pocket, eventually millions of people would go into crushing debt. That's not a guess, that's history. Because out-of-pocket financing used to be the primary way healthcare costs were paid. And it wasn't until a bunch of socialists, a bunch of unionists, and a bunch of doctors insisted that letting people go into poverty because of medical debt wasn't moral, that we shifted to a new payer model, the idea of insurance. Now, insurers are companies that receive revenue by charging you monthly premiums. When someone gets sick, insurers spend the money, they let everybody get a portion of those healthcare costs, plus keep a profit for themselves. So the more revenue an insurer receives from customers, or realistically, the more subsidy it receives from public money, the wider those costs are spread, and the lower the insurer's costs. That's called the risk per person costs. If an insurer has too many sick people, however, for example, if they get just one person with hemophilia whose care can cost up to $1 million a year, its per person costs can really increase. And so to compensate, it has to increase premiums. But when premiums go up, customers drop out because they can't afford those increased premiums. Except, of course, for sick people who can't afford not to afford those premiums, they stay on board. So all of a sudden you have a smaller pool that has a higher ratio of sick people, and per person costs go up even further. Thus, an insurer wants as large and as healthy a risk pool as possible, or it wants to find ways to kick out sick customers, or coerce them into leaving. Sometimes it drops coverage for the kinds of drugs sick people need, or drops coverage for the kinds of hospitals sick people go to. So the task of an insurance company is to make sick people, as much as it can, somebody else's problem. That's what we mean when we say that we live in a world in which healthcare is a commodity, right? Because future's on your heart and future's on your lungs and your chance of getting diabetes and whether or not your BMOS glaucoma gets better or worse before age 65 and she goes in Medicare are fiddled with and speculated about and bought and sold for profit by private companies. Now, over time, we've delegated the responsibility of providing insurance to employers. That results in the status quo of total employer domination, in which your access to things like contraception or what hospitals you can go to or hormone therapy are determined by the whims of your employer. But if you aren't lucky enough to have an employer, right, if you lack the so-called better skills to get the finite number of better jobs, you're just left behind. And so the people who profit from the commodification of our bodies have decided it's acceptable to shackle the well-being of children to whether or not their parents are lucky enough to have a benevolent employer. So welcome to the hell world that is America 2018. But it gets worse, right? Of course it gets worse. It's way too early in the speech for things not to get worse because the costs of healthcare keep increasing, and they increase much, much faster than inflation. But these costs have been increasing since we first began recording them back in the 1880s, faster than inflation. Part of that's for good reasons, right? More people are living longer with chronic conditions. Things like diabetes or trauma or cancer aren't the immediate death sentences they were even 2 or 3 generations ago. But most of these cost increases are because hospital CEOs and pharma companies, close personal friend Martin Shkreli, keep finding ways to charge more and more money for the exact same services, or rack up fees for unnecessary services, and no small private insurer really can settle, right? Here's what it shakes out. In the US, the average inpatient procedure costs 40% more than the same procedure when performed in France. Or take MRIs. You all know what MRIs are? MRIs are just big, fancy computers that print money. And in the US, an MRI procedure costs 5 times what the exact same machine performing the exact same procedure costs in Australia. The costs are high because the prices are high. Or, most egregiously, consider the relationship between primary care and hospitals. Primary care are things like checkup, basic medications, the kind of familiar, intimate health care you get from your family physician. It's high volume, it's low margin, and generally it's not super profitable. But now, conversely, a hospital gets paid an average of $2,000 a night for an inpatient stay. So if you're a hospital CEO, it makes a lot more sense to push folks into inpatient admission instead of wasting your time letting them get cheap primary care outside the hospital. Now, of course, this means diseases will be caught late, if at all, and people will get sicker and sicker and thus more and more expensive to treat, but at least the hospital and the hospital's specialists are getting paid. What's the result? Well, 58 million Americans live without access to primary care. Because, as you can see, there are 2 fundamental truths to American healthcare, the way it's structured now. One, if you are a payer, like an insurance company, it's just not profitable to insure people who are sick. 2, if you are a provider, like a hospital, it is extremely profitable to charge sick people as much as possible, as late as possible, as long as they got someone paying the bills. And so upon these jagged rocks, we've built this kind of stupid church of American healthcare, in which the body is valued solely as a source of profit. Now, this whole situation scares the bejesus out of everybody involved, right? Particularly the payers. Payers are interested in finding ways to mitigate rising costs. Sometimes this means refusing to pay for claims. You've all heard those horror stories. Before the Affordable Care Act, when the payers would often refuse to cover people who were or who were likely to get sick. You all know the phrase pre-existing conditions. But it's still just not enough to bring costs down. So we all got together in the 80s and invented the idea of consumer-driven healthcare. It's the idea that you should make consumers, which is just a libertarian way of saying people, pay more for the costs of their own healthcare. Because that'll turn them into smart shoppers somehow. And the power of the free market or whatever, they'll shop around and not get unnecessary care or too expensive care and find the cheapest ER in the county if they get hit by a car or like yelp their surgeons. And all this together will somehow drive prices down. But you know what's worse than that? It doesn't work. No, people who are forced to pay for healthcare costs they can't afford just don't seek health care. I don't mean catastrophic care. People don't seek primary care or preventive care. They ignore that. Try not to look at that too long. Think away that chestnut. Because we demand they bear the burden of healthcare costs they cannot afford, they turn their bodies into ticking time bombs until they have a heart attack at their jobs. And so here's the table stakes. Among so-called developed countries, America is the most dangerous place to be sick. Among peer countries, America is the most dangerous place to be black, the most dangerous place to be pregnant, with the highest maternal mortality rate anywhere in the developed world, the most dangerous place to be a child, the most dangerous place to be a woman, the most dangerous place to be gay, the most dangerous place to be old, and the most dangerous place to be disabled. Last year, life expectancy at birth fell for the first time in almost 30 years by a tenth of a year. Across 4 million people born last year, that's a theft of 400,000 years. But a funny thing happens when you look at these statistics, right? Because when you look at them more closely, you realize all this danger only exists if you're poor. Because the rich people in America are exempted from all these problems. Men born in the wealthiest fifth of all Americans get to live 15 years longer than men born in the poorest. Among women, that gap is 10 years. This is war. This is the terrible secret of American healthcare. They are killing us and robbing our corpses. I'll talk more on that maybe during Q&A. This big, stupid, multi-payer, profit-driven Rube Goldberg machine of American healthcare is failing us today and left unchecked will collapse tomorrow. So instead, we demand something, a federal, universal single payer. I'll keep this part brief. Single payer is a pretty simple concept. It's having a bunch of insurers with a bunch of fragmented customer bases, each seeking to avoid taking care of unprofitable sick people. We have one publicly owned, publicly funded insurer with a legislative mandate to cover in full all care for all people. That phrase, all care for all people, is important. Not Medicare as it exists today, but an improved Medicare for all that offers comprehensive coverage for all people in America, including long-term care for people with disabilities, that is free at the point of service with no cost share. Because everybody benefits when accessing care is affordable or free and easy. Delivering care, being a doctor, being a nurse, that's complicated. But paying for it is simple. And in fact, we're already paying for it. We're just forced to spend that money really stupid, right? American public money right now pays for 2/3 of all healthcare costs in America. Half of that is Medicare, Medicaid, and VA spending. Other half is direct government subsidies for private companies. The remaining third is out-of-pocket costs, which is additional tax paid of private companies in the form of premiums, deductibles, and co-pays. And so the goal is to reallocate the spending to care of everybody long-term. At the very least, a single-payer program keeps our national healthcare spending flat while reducing strain on ordinary people's pocketbooks. And this isn't a complex idea, right? Because you know that, for example, if you're right now, your private insurer only bears the costs of you receiving care right now. Because you're going to change insurers in the future and eventually go on Medicare, they don't actually feel pressure providing with care that keeps you healthy now or in the future, right? Instead, we all do, because we all suffer when our friends and family get sick and our public money is allocated to care for folks in times of crisis. This isn't a complex idea. I think you all know this already, right? You all know, for example, that if your window gets broken, the cold gets in. And if the cold gets in, you get sick. And if you get sick or your kid gets sick, you have to go to the doctor. And if the community clinic was shut down or it's booked solid, you got to go to the hospital. And if the hospital is far away or you don't have a car, you have to take the bus. And if you take the bus, or if there isn't a bus, you have to spend all day dealing with the bus system or getting a ride. If you spend all day dealing with getting a ride, you can't go to work. And if you can't go to work, you can't afford to fix the window that caused the problem in the first place. And so the answer isn't to fork over a pile of cash every time you go to the hospital. The answer begins with fixing the window. But there are no private actors in the American model who will bear responsibility for fixing these problems on their own, right? The insurance industry is incapable of addressing the foundational problems of healthcare, fixing broken windows, and opening the closing clinics in the exact same way that a billionaire is incapable of lessening income inequality. They cannot fix the injustice because they have been constructed by that injustice, and thus cannot conceive of these problems in the first place. Almost done, one more thing. But we all can fix these problems. And so it makes perfect sense that the same actor who suffers when people don't get care, which is all of us united, represented by our federal government, should be the actor that pays for that care in the first place. Because once the federal actor bears the costs of providing care and the risks and costs of not providing care, it can finally be used as a tool for realizing health justice. If your people are getting sick and dying instead of a place to live, or the places to live are unsafe, then housing is healthcare. And you must build housing to bring healthcare costs down. People are getting sick and dying because they don't have access to healthy food to eat, so they're getting diabetes or comorbidities like cardiac failure. Then food is healthcare. And you must provide people with affordable or free food options to bring healthcare costs down. People are getting sick and dying because they don't have access to needle exchange programs, therapy, or counseling. Then rehabilitation is healthcare. And you must build addiction treatment programs to bring healthcare costs down. Because a single payer is only the tool. Health justice is the goal. And when we fight for health justice, we all fight side by side. Because economic justice is health justice. Environmental justice is health justice. Reproductive justice is health justice. And justice for Black lives, justice for trans lives, justice for lives of immigrants, and the well-being of all people, regardless of age, gender, race, or creed, that's health justice. I know I'm running low on time, so I'll cut it there. Single payer is not the revolution. It is just our first counterattack in the war that is already waged against us, by which subsequent counterattacks are made possible. And on the spectrum of health justice, there are a variety of changes we can make to provide material relief now. On the local level, maybe you organize for a needle exchange program or for increasing guaranteed paid sick leave. They just won in Austin. At the state level, maybe it's Medicaid expansion. At the federal level, I think we fight for a federal single payer. But what we're fighting for is the decommodification of human health and the broader reform that's necessary to treat people like people and restore them the dignity that the private market has robbed. Thank you. Yes, I can hear you.
Earlier you said you were going to stay around for questions and to hear the other panelists. You're able to do that?
Yeah.
Okay, great. Thank you very much. I have a question for you just right now. The title that we're working on here is Healthcare a Human Right? And I guess you clearly described the problems that we have and what your perception of the solution. Do you think that question, whether healthcare is a human right or not, is pertinent for solving this?
I think healthcare, I think healthcare is either one or two things. It's either like a basic civil service, adequately wealthy state has an obligation to provide to its citizens or to its residents, or it's a human right. Either of those I'm fine with. I don't know if, I'm sorry, I'm getting feedback again. I don't know if sussing out which one it is pertinent, because ultimately it's a responsibility, whether for moral or practical reasons or civil reasons, it's a responsibility that any sufficiently prosperous government owes its residents.
Thank you.